gather around to hear a story. A spooky story. A spooky, scary story of monsters and wounds and diseases. Yeah, we're talking about the New Zealand public healthcare system today. Not the most fun. Kia ora everybody. Yes, today I'm going to be talking about the public healthcare system in New Zealand. And in a previous video, I did state that I think it's one of the best things about New Zealand. And I stand by that on paper. Unfortunately, it has been mismanaged and treated quite poorly, like a ginger middle child, and it is quite close to the breaking point. I want to start by saying this isn't some cheap shot at the coalition government. This has been an ongoing problem for a lot of governments for the last 10 years or more. At this point, right now, after over a decade of government after government dropping the ball on our healthcare system, it is estimated that we need to inject $1.4 billion into our healthcare system just to get it back onto float, back to par. And unfortunately, the current government isn't doing this better. They're really out for blood. Blood. Halloween, monster. Did work, shut up. Our government is unfortunately trying to make problems worse. We have people being asked to voluntarily give up their jobs. And we don't want that. Even without the money aspect, we don't want people going into hospital and coming out worse than they already are. And things are already bad enough. The New Zealand healthcare system is so overwhelmed that on August the 1st this year, 2024, Oamaru's hospital had to shut down its ER department because it was overfilled. How does that happen? That shouldn't happen. You don't want to be going to the emergency department and saying, oh no, sorry, we're all out of stuff. That's bad enough when you go to a restaurant and you want to order a burger and they don't have the patty for it. You can't get that you shouldn't get that at a hospital. So what you might figure out is that this isn't the end of the video. That's right, it only gets worse from here. So strap in. Back in March of 2024, the New Zealand Medical Journal announced that there is a shortfall of doctors in this country equal to 1,700. And back then, they estimated that over the next 10 years, that number would double. Of course, that was back in March, and since then, we've had job cuts, we've had funding cuts, and we've had a broken promise. A broken promise specifically to Dunedin's hospital. Now, Dunedin's hospital is one of only 2 medical school hospitals. Training hospital. There is also the major hospital for the entire bottom of the South Island from pretty much Oamaru downwards, as well as Stewart Island and I think Antarctica. Yeah, I've heard that somewhere. Can't find a source on that, but you know. Now, they've been wanting to build a new hospital because they have to, possibly deal with so much. Those people going to ER on the day that Oamaru Hospital had to shut down, they would go to Dunedin. So they've been wanting to build a larger hospital that can help more people, have more staff, and really do what it needs to do. It was initially budgeted about 10 years ago at $1.4 billion. It went over budget by about 400 million, and the last government really wanted to cut that and say, no, we're not doing that, but they allowed it in the end. But quite iffily. One of the selling points of the national government, Christopher Luxon, was that they would not cut any funding to Dunedin's hospital. Guess what? Broken promise, another lie. they have stated that they will be cutting the funding because they're overspending too much. But then something pretty amazing actually did happen. The people of Dunedin and Southland, Otago, not happy about that. And there was a massive protest. 35,000 people marched in Dunedin in protest of this cut. 35,000. That's 3.5 times what Saruman needed to not get into Helm's Deep.
What do we want? Now. When do we want them? Now. What do we want? Now. When do we want them? Now. Beautiful. Build it once. Build it right. Build it once. Build it right. What do we want? Now. When do we want them? Now.
And that is such a great show. We all need to be doing this because it's not just the Dunedin Hospital that needs help. All our hospitals need help. They need improvements, they need more funding, they need more staff, they need better paid staff. Because currently in New Zealand, there are 30,000 people who have been waiting 4 months or more for operations. There are 5,000 people who have been waiting more than a year for operations. The public healthcare system is so burnt out that there are private healthcare practitioners coming and taking over to lend a hand for the public sector. I mean, that's beautiful, don't get me wrong, but it shouldn't happen. We shouldn't need that. And that's going to bring me to something later on, you rich people who are not letting us have our public system, so bear it. Stick there. Even outside of the hospital system, general practitioners are feeling the sting as well. Across the country, they've had to increase their prices by 8% this year alone. And with the thousands of job cuts that the government has graciously given out this year alone, people can't afford to go to the doctor when they're symptomatic. So they either get worse or they come to the ER for free treatment, which puts more of a strain on an already wanting and strained healthcare system. It just goes around in circles. And our government seem to want this. They want all this to burn to the ground so they can make a very expensive private healthcare system that no one's going to be able to afford. And that's awful, because I'm going to have to go back and re-edit my top 4 best things about New Zealand video and cut this out and put something else in. And worse, people are going to suffer and people are going to die. Those of us who are poor, underpaid, or jobless are already very scared of this. It's a legitimate fear. But it doesn't matter because it's all in the hands of those who are rich. So I want to talk to the people who are actively trying to make this happen. I want to run it down in about 3 layers. First, who do you think works for you? It's the people you're underpaying who work for you. If they get sick and can't come to work, you're going to have a lot of trouble firing them. You're going to make less money, okay? If they can't get better, you won't have a worker. You have to go out of your way to fire them, give them a severance package. If you muck that up, they can sue you for a lot of money. It's a big hassle. And then you've got to train someone new in their place. Public healthcare really works for you. But hey, it's only tens of thousands, hundreds of thousands of dollars. It doesn't matter too much to you, right? Well, I'm going to come at you for the second layer now. Remember when I said that there is a shortfall of 1,700 doctors currently in New Zealand, and that's going to double in the next 10 years if nothing's done? And since then you've cut down Dunedin's public hospital, the teaching hospital. Where do you think your doctor is going to come from? Because you're going to be paying a lot of money for, well, everyone's going to be paying a lot of money for private healthcare. And there's not going to be enough doctors to go around for everyone because of the massive shortfall that's going to happen. And so your doctor's going to be stretched thin, trying to take care of a lot of people, and then you aren't going to get the healthcare you are going to want in 20 years' time. All right, we're not America. We're not ready for the public healthcare, the private healthcare system. It won't work, and you're going to hate it in 20 years when you have to share your doctor with 100 other people. Now, if you're not scared by those first 2 layers of healthcare hell, if you're not scared about the idea of losing lots of money in your businesses unnecessarily, if you're not scared of your burnt out, underpaid doctor and nurses having to take care of dozens of other patients, then I've got one final layer of healthcare hell for you. If you continue to underfund hospitals and they're unable to grow as the population expands and everyone has to be on private healthcare, then you're going to find a lot of your private rooms being converted into wards. But then you might get lucky. Maybe you're in the very rich group that can really afford that private room. But again, there's not enough infrastructure to keep up with population growth. And then you end up in a bucket list situation. But let me tell you, you're probably not going to get a Morgan Freeman buddy in there. You're going to get a roommate like me. And you're not going to like someone like me. In fact, you'll spend every sleepless night lying there wondering what went wrong if you were sharing a room with someone like me. On a lighter note, for every healthcare worker out there who isn't leaving the country for better prospects and staying despite the terrible working conditions and pay, I thank you from the bottom of my heart. It is amazing work that you do. You're keeping the people of this country going. You really are. And you deserve so much more. We all deserve so much more. I can't say much more than that. I sincerely hope that you all get to enjoy the rest of this Halloween and the holidays to come. And hopefully we won't have as bleak a future as we're predicting. Ka kite ana. Thank you.